Hi everyone, welcome to Fast Intelligent Care. This is our part 3 of our series with Natasha Nutt from Movementum. So in our previous episodes, we talked a little bit about her background in OT and as a manual handling consultant and trainer, and then how Movementum has developed. And then we also looked a little bit on single-handed care specifically. And then today's episode, we're going to look at safe work quality care, which I believe is the ethos of Movementum, or the belief that Movementum have. So, Natasha, I would love for you to be able to give us a bit of a breakdown of what that means, safe work quality care.
Wonderful. Thank you so much, Chanelle, for having me. I could talk about safe work and quality care forever because it really is what underlies everything we focus on at Movementum. So when someone requires care support, so whether it's in the space we work in, it's largely physical disability, but it doesn't need to be. It's whenever anyone needs someone else to come and work with them to achieve a task or to achieve what they need to, then that becomes a partnership. So really for me, it's that work needs to be safe and quality. So it's safe work and quality care. They should never be in tension. It should never be that we prioritize one over the other. They have to coexist, that care dynamic becomes a partnership. And so the individual receiving the care has to receive high quality care, and that should always be our goal. And alongside that, we need to ensure that the person delivering the care is safe to do so, that's going to be sustainable and repeatable, and regardless of what carer comes in to deliver that, they can do so. So really, we believe that they have to exist together. It is a partnership, and that we should be designing care that is safe and provides quality. It's not one or the other.
And how do you see OTs supporting the support workers as well as supporting the client in terms of that, having that quality care and also having the support workers be safe, or
Yeah,
whether it's the family member
amazing.
as well?
We are in such a crucial role, and we have the skills to do this really well as OT. We are in a unique position that we have accountability to the client. So that if you've received a referral that you're going in to assess for a particular piece of equipment, whether it be a new wheelchair, a transfer device, whatever it may be. But we also have an obligation to the carer, which may be a worker, it may be the family member. We need to make sure that whatever we implement and whatever we recommend for that person to receive the quality care they need, that it can be performed safely. And so whatever we recommend and prescribe, that it can actually be used safely, efficiently by those doing it. So for an
Yeah.
OT, we really need to look at that whole system in terms of the person, their task, the environment that they're working in, the equipment, and the carer. And it's how is the person going to partner with the client to use this equipment, and making sure that right from the get-go, right from that beginning, we're thinking about our prescription and our assessment in that way. That's how is this going to be sustainably provided, and who needs to be using the equipment to support the individual.
And is there any assessments out there that you think could be beneficial to use that are either looking at whether it's standardized assessments, but looking at not just the assessing the individual, but also looking at I guess the carer's satisfaction, how they are experiencing the task. Is there any risk assessments or assessments that you would recommend?
Yeah, we use, in terms of specific assessments, I use the tile risk assessment specifically for manual handling, because for tile, it breaks down and looks at the task that's needing to be completed. So that's the T. The I stands for the individual. And with that, that is the person receiving care and also the carer or the family. So the great thing about that is it's looking at what are the skills and capabilities and considerations for the individual and their carer. Then you're looking at the load, which is the L, and the load can be the equipment, it can be the individual client as well, and looking at what is actually the load that's needing to be moved or positioned. And then the E stands for the environment and the equipment. So I feel like Tile does a really great job of helping you if you're assessing a specific task, at breaking down and going, well, where are the issues or where are the risks across all of those factors that help you get a really holistic view. And also, the greatest assessment really is actually observing the task in real life, in the real environment. Having a simulated completion of a task can give you some information, but really observing the task gives you so much quality information, and involving the care providers as well. So I often will, with consent from the individual and the family, will then reach out to the key care providers, so the support workers, to actually find out from them what is working well, what's not working well, what are they finding difficult, because it can be really hard for a support worker to say those things to an OT when you're out on the visit. They have relationship with their client, they have rapport, and we place them in a really difficult position if we expect them to speak up in that situation to say the things they're finding hard. So really trying to make it as easy as possible for anyone who's part of that care relationship to be able to give you the information they need to without it jeopardizing that relationship and that rapport. So sometimes that can be dialing into a team meeting for the care provider, or just simply giving them a call to ask how things are going, letting them know why you're doing an assessment and asking for their input. Because really, when it comes to then making recommendations or implementing change, if we haven't engaged the people who are actually doing the task, we are very unlikely to see whatever we recommend being in use in 6 months' time. So that assessment, yes, we can have standardized assessments or structured assessments like TILE, but also there's so much value in opening the conversation and inviting that quality input from all the parties beforehand.
So it's a very thorough process. It's not something you're just going to do in one assessment. It's going to have to be something that you're covering quite comprehensively. And something that I like that you mentioned is about having those conversations with the support workers, not necessarily with the client present, because I have had a situation where it was a family member that was the carer, but I was told by my OT mentor at the time that I have to do a caregiver burden scale for them. And the purpose was to bring in manual handling equipment. But I remember just the name of the assessment. The mom she was like, well, he's not a burden. Like, I don't want to talk about him as a burden. It is actually something that, like, that's not like those people that are in there, they want to support the client, they want to support the individual. And I guess they need to feel safe to be talking about those things without it feeling like they're complaining about the person, or they're framing them as a burden. It's more, how can we make this easier for you? How can we make this safer for you? And as well for the person that you're supporting. Rather than it as this problem that we have to solve, because the client's not the problem. It's just how do we do this the best way as possible.
That's exactly right. And for a support worker, they can feel like they're betraying the client by speaking up about anything that's hard. And I'll often hear support workers say, oh, but I'm happy to do it. I just want to make sure that they're comfortable, or that I've done a good job and I've done it the best I can. And so we need to validate that and acknowledge that and go, I know, and you're doing an incredible job. And what this is about is, how do we allow you to keep doing that incredible work, but for it to be safe for you to do so, and then sustainable so it can continue. So yeah, I do feel like creating a safe space for them to be able to provide input that doesn't feel like they are betraying confidence in the client, or that they're complaining, or that they're saying things are too hard. It's really just about consulting. It's consultation and bringing them into the conversation so that they become part of that creative solution finding as well.
So I do have a few very practical questions. So how, and I know we've talked about this a little bit earlier as well in the previous episode, but how often, or how would you have those markers that you mentioned in the previous episode that you give to know when it might trigger a review? But what would you give advice for an OT very practically? How do I know that I need to review the risk assessment?
And really, at a minimum, it's when something changes. So there's been a change in the capacity of the client, there's a change in the environment, or new equipment has been introduced, or there's a change in care provision or staffing. So when there's a change is a really good trigger for a review.
Yeah.
In practice, often it's not reviewed unless something goes wrong, which is really not what we want to work towards, but we know with funding models that can happen. But best practice is that they would be scheduled reviews. And so in care plans and service agreements, we would actually have that we will go in and review in 6 months, particularly for equipment like standing lifters. And as I said, making sure that the care staff and the family are trained up in knowing what to look for to trigger that review, because they're the ones doing it day to day. So it's really important to partner with them to get them to trigger that review as well.
I loved your tip about the photos. I think it's great visually seeing what it looks like when it's done right.
Yes.
What is that? Picture paints a thousand or says 1,000 words or something like that.
Absolutely. Because I have support workers come to training that when we practice things like the standing lifter, that they will make a comment like, oh my goodness, I didn't realize that's what it's supposed to look like, because they have been using it in a way where someone is hanging from the lifter to complete the transfer and they've never known that it shouldn't look like that, because at the point where they were introduced to the care routine, that's the way it looked from the outset. So having those visuals can really help families and care teams know what safe looks like and when they need to trigger a review.
And I've had a few times where, especially with nurses, where where I've gone to do just showing them some equipment, some slings, and they'll start describing kind of the posture of the client and how they're concerned. A lot of times they're thinking it's sizing of the sling, and then when they actually, after they've done the training, they're like, oh wait, actually this person actually doesn't have the core strength for the trunk control to use this sling. So it's like a hygiene sling especially. But then it's once I show them those pictures, they're like, oh wait, actually it's not the size.
It's the sling itself and it's not providing the support.
Yeah, so it is. Those pictures really do help a lot. So I like that's a really good practical tip. And I think also great that you added in building that into your plan to still do a review every 6 months for in case that doesn't happen, in case you're not told that there's been a change or that they think it needs a review. So really good practical tips. And I think in terms of risk assessment, the TAL I love as well. I think it's good that it's very holistic. And I do use that quite a bit. I have heard some say it's more UK based, but I think it's very relevant. I don't think it's something that, I think we can use it in Australia. I don't think it's, even though it's a UK based assessment, I think it's very relevant here.
Absolutely, because it's really just trying to capture the whole picture.
Yeah.
Of what does the care service exist within, and the whole environment and the whole picture of that care ecosystem. So I think it's a valuable tool no matter where the care is being provided.
Yes. And thank you. Thanks for giving a very good explanation of that as well. So a recap of today's episode, we talked about safe work quality care, how to do risk assessments, how to know that you need to do a review of your risk assessments. So really good practical tips. Our next episode, we'll go a little bit into some very specific things on how to avoid those mistakes in terms of when you're prescribing things like your hoist, standing aids, and slings, some lessons that you've learned over time, and some practical tips for that. Great.
Fantastic.
Thank you for your time, Natasha. I'll see you in the next episode.